afternoon, and thanks for joining us here at NOLA News. We have some exciting stories coming up this afternoon. Dr. Zadlow is here, and he is discussing current clinical trials that he's performing in regards to mild cognitive disorder. As a brief introduction, concussions affect about 20% of high school athletes, and there's no clear-cut solution for diagnosis or rehabilitation. What is understood is that it's a type of traumatic brain injury caused by a bump, blow, or jolt to the head, or by a hit to the body that causes the head and brain to move around rapidly back and forth. The sudden movement can cause the brain to bounce around or twist the skull, creating a chemical and physical change to the brain and possible dysfunction. About 90% of concussions resolve within 2 weeks of injury, but the remaining 10 progress into what is classified as mild cognitive disorder. Mild cognitive disorder entails concussive symptoms that persist for at least 6 weeks or a year, up to a year following the injury. So I'm going to take you out to the field at Tulane Center where Dr. Zadlow is conducting his study. Thank you.
Thank you so much, Natalie. I'm out in the field with Dr. Zadlow, who's going to explain to us this new study. So, Dr. Zadlow, can you tell us a little bit about the purpose of this study?
Sure. Thank you for that wonderful introduction, Sarah. This study aims to investigate the effect of mild physical activity on alleviating symptoms and accelerating return to play in patients with mild neurocognitive disorder. Half of the participants will be instructed to partake in a daily exercise regimen, while the other half will receive the current standard treatment of care. We hypothesize that patients in the physical activity group's SCAT-3 scores will be less severe relative to the normal treatment group, and they will report lesser symptoms on the PCSS and PCSI when compared to the standard treatment group the same month of treatment.
So can you tell me a little bit about how you're recruiting these subjects into the study?
Sure. So participants will be selected through the Louisiana CATS, which is the Clinical and Translational Science Volunteer Research Registry. Louisiana residents who wish to be the subjects of research may fill out a volunteer research registry form. Those in the registry who meet the inclusion and exclusion criteria for the study of mild neurocognitive disorder at the discretion of a physician will be contacted if the recruits are a match for the study. This mild neurocognitive disorder study will also be registered on clinicaltrials.gov and allow the public to see and learn more about the study's purpose and eligibility criteria, and reach out to researchers if they are interested in being participants.
Great. So could you tell me a little bit more about who is eligible for this study and who is not?
That is a great question. Participants will be high school athletes aged 14 to 18 years of either sex that have been diagnosed with mild neurocognitive disorder by a neuropsychologist. Participants will be excluded if they have had any prior concussions, have been diagnosed with any mental disability.
That sounds wonderful. So I'm getting a really good idea of the high school athletes that will be participating in this study. Can you tell me a little bit more about what the athletes in the exercise group are going to be doing as opposed to the athletes who are in the standard treatment of care group?
The standard group will receive the current standard of care for mild neurocognitive disorder, which includes rest and a gradual return to play via the gradual return to play protocol. The physical intervention group will participate in an individual exercise program.
Wow, that sounds really interesting. Why don't we head into the gym and see exactly what this exercise regimen is going to look like?
The physical intervention group will participate in an individualized exercise program. To determine this program, the subjects will start on the treadmill set to a speed of 3.3 miles per hour and an incline of 0.0%. At the end of the first minute, the speed will remain the same, but the incline will be increased to 2%. At the end of the second minute, the incline will be increased to 3%. At the end of every minute for the duration of the test, the incline will be increased by an additional percent while the speed remains constant. The test will end when the patient experiences exacerbated symptoms of mild NCD, which will be determined by self-reporting. When the patient walks on the treadmill, he or she will be monitored in the following ways. Blood pressure will be taken every 2 minutes, heart rate will be recorded every minute using a heart rate monitor, and the Borg scale for perceived exertion will be recorded every minute. This first test will determine the time and duration of the exercise program. Subjects will be instructed to participate in aerobic exercise 4 days per week that can include swimming, running, walking, hiking, or stationary bike. They will exercise for the amount of time they are able to complete the treadmill test and at an intensity 80% of the maximum intensity they achieved during the treadmill test using their heart rate to measure intensity. Subjects' programs will be altered each week using the intensity and time recorded for the most recent treadmill test.
And now we're going to turn to Dr. Davis, who's going to explain to us the data analysis plan for this project. He unfortunately couldn't be here with us today, but over to you, Dr. Davis.
Both groups will return to the Tulane Institute of Sports Medicine each month, and their progress will be evaluated using the treadmill test, PCSS, PCSI, and SCAT3. These tests will be administered by psychometrists. Subjects will remain in the study for 6 months. Data will be collected from the standard group, which is used as a control for this experiment, and the experimental group, which will be the one receiving the altered physical intervention treatment plan. Each group will receive a baseline examination at the start of the experiment. The means and standard deviations for each group, as well as for each individual within his or her respective group, will be collected and compared to assess any statistical significant changes which would test our hypothesis. The research results will be tested for statistical significance in terms of recovery time using a one-sided independent t-test. We hypothesize that subjects in the physical activity group will show a significantly increased recovery rate compared to those in the standard treatment group. As such, the physical activity group is expected to have greatly reduced symptoms of PCI by the end of the second month of treatment. Furthermore, the patients should be able to perform for a longer duration and at a higher intensity during the treadmill tests without exacerbating their symptoms. Additionally, we hypothesize that patients in the physical activity group's SCAT3 scores will be less severe, and they will report less symptoms on the PCSS and PCSI when compared to the standard treatment group at the same month of treatment.
Wow, thank you, Dr. Zadlow. That study seems very interesting. I'm excited to hear the results. Thank you for joining us on NOLA News, and now we're going to go over to Nancy to discuss how Mountain Dew may be the leading cause of Alzheimer's. Back to you, Nancy.